Can you see my presentation? Presentation కనిపిస్తుందా?
Yes, sir.
Yeah. So today's my topic will be developmental disturbances of oral and para-oral structure. It is the first chapter in your oral pathology. Sharp's textbook. This is actually the first chapter. Developmental anomalies or disturbances that occur in the oral cavity. Usually, if you remember the development which you have studied in your embryology in your first year, you have a lot of stages of development. You see, for example, tooth development, if you remember, you have the bud stage, cap stage, bell stage, advanced bell stage, and in a series of development, step by step, the development takes place until finally you get the final matured organ or tissue. Even the development of palate, development of tongue, mandible, maxilla, even again, you have different steps of development initially. And there are three germ layers basically: ectoderm, endoderm, or mesoderm. And any tissue or any organ in the body has to develop from only these three tissues: endoderm, mesoderm, or ectoderm. And final product is what we see. And here in the head and neck region, similarly, all the organs, all the tissues present, hard tissues and soft tissues of the head and neck region develop from any of these three germ layers: endoderm, mesoderm, or ectoderm. And during the development, usually if you see, if everything goes on time as per the schedule, you get a final product as per the requirement. The tooth development, all the stages happen properly. Finally, you get a good tooth structure and size and shape, everything. But if there is a disturbance in any of the developing stages, processes, then the final product may be defective, or there may be some alteration, or sometimes there may be missing also completely. So these are the things or structures which we will be studying in developmental disturbances of oral and para-oral structures. So all the tissues can be affected during the development. And what are those developmental factors that can lead to the developmental disturbance? All those things also I will be going to discuss with you. So these are the contents of this chapter. If you see, what are the structures that are there in the head and neck region, and what all the anomalies related to those structures will be enumerated in this chapter, starting with craniofacial anomalies, developmental disturbances of teeth, that is all the anomalies of teeth leading to their change in size, shape or structure. Similarly, developmental disturbances of jaws. We know the normal development of jaws, maxilla and mandible. Any disturbance that can affect the normal development can lead to an alteration in its final product. That is the developmental disturbances of jaw. Similarly, developmental abnormalities of dental articulations